بسم الله الرحمن الرحيم. أنا الدكتور محمد قطب، أنا أستاذ الأنف وأذن الحجرة في كلية طب جامعة الفيوم، Professor of Otolaryngology in Fayoum University, Egypt. Today I'm going to speak about anatomy of the ear. We should classify the anatomy of the ear into anatomy of the external ear, middle ear, and internal ear. External ear is composed of three parts: the auricle, the external auditory canal, and the tympanic membrane. Let's start with the auricle. It is a cartilage covered by skin connected to the skull with some ligaments and some muscles. This skin, take care, is adherent to the underlying pericondium, especially on the anterior surface of the auricle, while the behind surface is loosely attached. Now go to the external auditory canal. The external auditory canal is partly cartilaginous, as you see. This is the external part, and partly bony towards the inside. It is about 2.4 centimeter and oval in shape. Can you see in this section? This is the external part. It is the cartilaginous part. It is about 8 millimeter long, and it is continuous with the cartilage of that of the auricle. Take care. It is very important that this skin is lined by this is a part of the external auditory canal is lined by skin. This skin contains hair follicles, fat and sebaceous and cereminous glands to secrete the cerumen. While the internal part, which is the bony part, is about the inner 2/3, about 16 millimeter in length. It is the medial or inside part that is within the skull base, and it shows at the inner side of it here at the drum, the tympanic sulcus through which the drum is inserted. It is lined also by skin, but take care, this is devoid of hair or any glands. Now we see to the other part of the external auditory canal, that is to say the drum. Take care. Anatomically, when we speak about anatomy, the drum is considered part of the external auditory canal, while by pathology, and we're going to talk to you later on, it is part of the middle ear. That's inflammation of the drum is considered a part of the middle ear. This tympanic membrane lies within the tympanic sulcus. This is the tympanic sulcus. Can you see it? It is the inner part of the external auditory canal. The drum is a slightly oval. It is about 0.1 millimeter thickness. It is composed of two main parts. This is the upper part, and this is the lower part. The upper part is called the pars flaccida. This is the way, and this is the lower part, which is the pars tensa. This is the normal appearance of a drum. This here upper part is the pars flaccida, and this the whole drum is considered the pars tensa. Actually, it is composed of 3 layers. Here a diagram to show that the drum is 3 layers. The layer which is red in color, it is a squamous epithelium continuous with that of the skin of the auditory canal, and the green one is the inner mucosal layer which lines the middle ear, and the yellow one, which is the fibrous tissue within the drum, which is deficient in this upper part, which is the pars flaccida. Yes, so it is flaccida, that is to say it is a flaccid. It's not tough like the rest of the drum. Can you see the drum can be seen? There is a cone of light in the antero-inferior part. Take care. This is anterior, this is posterior, this is superior, and this is inferior. So this is the right drum. Can you see? This is part of the drum which is called the annular ring. It is the condensed fibrous tissue layer at the periphery of the drum. This is called the cone of light, which reflects the light when you are going to examine the drum with the source of light. This is called the ambo, and this is called the lateral process of the Mealy's bone, as we're going to talk. And this is the upper part, which is actually at the pars flaccida, is called the attic, and we'll talk about it later on. Now, this is the drum again here, and this is part of that bone, which is called the malleus, which forms about protruding part, and this is called the attic, and this is the bursa flaccida of the drum. Now we can reach the middle ear. What is the middle ear? It is, yes, also composed of three parts: the middle ear cavity, the Eustachian tube, and the mastoid bone. Let's come to the first part, the middle ear cavity. This is the drum, yes, and this is the middle ear cavity. It has actually three parts. Part which is just in front of, just opposite to the drum, it's called mesotympanum. Part above the level of the drum, which is called epitympanum. Epi in Latin means above, which also has a name of the attic. This part is called the attic. And part below the level of the drum, which is called hypotympanum, and hypo in Latin means below. Now the middle ear can be considered as a six wall. The lateral wall, which I've removed it from this diagram, is the drum. This is the anterior wall, posterior wall, superior wall, inferior wall, and this is the lateral wall. Sorry, this is the medial wall. And we have said that the lateral wall, which is the drum, have been removed from this diagram. Let's take one by one wall. Again, this is the drum, the external auditory canal, and this is the middle ear cavity. Where is the roof? Yes, there is the roof. The roof is the tegmen tympani. Tegmen tympani is a thin shelf of bone which separates the middle ear cavity, that is to say the epitympanum, from here. What's here? Here the brain. Which part of the brain? The brain stem, the temporal lobe. Sorry, the temporal lobe of the brain. This is called the tegmen tympani. Now, can we see the roof? Yes. Here's the tegmen tympani. This is the skull, which is open from inside, to tell you that this is the temporal lobe of the brain, which is lying here in the temporal fossa, and this is the part of the tegmen tympani which represents the roof of the middle ear. Again, what is the floor? Can you remember? This is the superior sagittal sinus, which drains the brain. At the end of the superior sagittal sinus, this is what's called a transverse sinus. Then transverse sinus is going to become what's called a sigmoid sinus. And here this sinus is the jugular sinus, or the jugular vein, which becomes the jugular vein in the neck. Here in this area, it lies below the middle ear. That is to say, there is a small shelf of bone which separates the middle ear, or the hypotympanum, from this dome of the internal jugular vein. And take care, sometimes this shelf of bone is not present, is absent, and this jugular vein become inside the middle ear. It's called high jugular foramen. Again, this is the same picture here. Can you imagine the external auditory canal? And here the floor of the middle ear, and here the jugular vein. Here, yes, this is the transverse or sigmoid sinus, which turns like that within the mastoid bone, and here it comes in the floor of the middle ear. Here's again the same. Here we have said that this is the roof, this is the sigmoid sinus. When it turns to exit the skull through the jugular foramen, here in this area it lies below the middle ear, below the hypotympanum. Can you see it again? Yes, yes. This is the drum, the epitympanum. Yes, this is the tegmen tympani. Yes, and this is the hypotympanum. Yes, and this is the floor of the middle ear, and this is the jugular vein. Can you see also? The last four cranial nerves come through the skull, through this jugular foramen. Actually, we should correct this information that number 9, 11, and 12 cranial nerves come through the jugular foramen, while the 12th, the hypoglossal nerve, exit from the skull through the hypoglossal canal. Again, we have talked about the roof and the floor. Yes, let's come to see the anterior wall of the skull, of the middle ear. What's the anterior wall of the middle ear? Can you see? It shows, number 1, this is the muscle, which is a very important muscle. It's called the tensor tympani muscle. So the anterior wall harbor a canal for tensor tympani muscle. This tensor tympani muscle is attached to the malleus bone, and it is very important. Take care, it is supplied by the trigeminal nerve, and we are going to talk about it later on. With it, just below it is the opening of the Eustachian tube. Again, come see it again, an opening for the Eustachian tube, and the tensor tympani muscle canal. And what is this? Yes, this is the internal carotid artery, and there is a small shelf of bone here which separates the anterior wall of the middle ear from the internal carotid artery, like this picture. Tensor tympani attached to the malleus, opening of the Eustachian tube, and the internal carotid artery. Take care, this picture is from the middle ear, as if we are going to stay in the middle ear and we look to the drum from inside. And don't forget, this is what? Yes, what is this? This is the internal jugular vein. Again, what is the posterior wall of the middle ear? We have talked about roof, inferior, anterior, and then we come to the posterior wall. There is opening here, it's called the adductus ad antrum. This is an elevation which is called the pyramid. Let's see what this structure is. This is the opening between the middle ear cavity and here a bone which is filled with air cells. We're going to talk about it again later on. It's called the mastoid bone. It's formed of air cells. The biggest air cell here is called the antrum, the mastoid antrum. And this opening, which is from the middle ear cavity to the mastoid antrum, is called the adductus. It lies in the posterior superior part of the posterior meat of the posterior wall of the middle ear. What also? There is a pyramid. It is a projection of bone like a pyramid, from which is attached to the stapedius muscle, and this muscle is attached to a small bone called the stapes bone. And here, very important structure for us, it's called the facial nerve. We're going to talk about facial nerve later on, but now this is a vertical part of the facial nerve which descends within the posterior wall of the middle ear. Here is again the drum, the ossicles of the middle ear, and this is, can you see it, as we are looking to the posterior wall of the middle ear like this. Yes, there is the adductus ad antrum. Yes, and this is here the part of the facial nerve. This is the facial nerve, and this is the vertical part of the facial nerve. And here, can you see it? This is the pyramid to which is attached the stapedius muscle to the stapes bone. Then the lateral wall. What's the lateral wall? We have removed it from the first slide. Yes, this is the drum, and we have talking about it. Can you see this image? This image is from inside the middle ear, and this is the drum, the lateral part of the drum. That is to say, we are going to see the inner aspect of the drum. Yes, this is the drum from inside to which is attached the malleus bone. The pyramid, this is the part of the facial nerve have been removed. This is the anterior part, which is the tensor tympani muscle, the opening of the Eustachian tube, and here is lying the internal carotid artery. This is the roof, the tegment tympani, and there is the floor separating it from the internal jugular vein. The same picture here. Again, we are talking about rapid revision: anterior wall, tensor tympani, Eustachian tube opening internal carotid artery, roof, the tegment tympani separating it from the temporal lobe of the brain, floor separating the middle ear from the jugular vein, posterior wall show the adductus ad antrum to the mastoid antrum, the vertical part of the facial nerve, and the pyramid to which is attached the stapedius muscle. What else is left behind? The medial wall. Yes, this is a very important part, the medial wall of the middle ear. Can you see? Yes, in this diagram there is opening here and opening there, and there is a protrusion in the middle part of the medial wall, and this is part which is going from up to back and then inferior. We are going to talk about it. Actually, this is a diagram showing the actual normal anatomy of the medial wall of the middle ear. What is this yellow part? This is the facial nerve. Facial nerve is a very important anatomy, and there is an important lecture for it later on. It comes from inside here, directly direct lateral, then it turns like this in the upper part of the medial wall of the middle ear, then it turns around the stapes bone here, then it descends vertically within the posterior wall of the middle ear. Here, this part in the upper part of the medial wall of the middle ear. This is number one. Number two, here, this is the stapes bone. The stapes bone is closing what's called the oval window. What's the oval window? This is a connection between the middle ear and what's inside the inner ear. Yes, and this is closed by membrane and by bone, the stapes bone. Here is another window just closed by membrane. Yes, also separating the middle ear from the inner ear. It's called the round window. So up is the oval window, below is the round window. And here is what's called the cochlea. The cochlea, the basal turn of which is protruding inside here, forming what's called the promontory. So let's go back again. Yes, there is the oval window, which is closed by the stapes bone, the round window, which is closed by a membrane. Yes, this is the promontory, which represents the basal turn of the cochlea, and here is the upper part of the medial wall of the middle ear, which runs the transverse part of the facial nerve. Yes, that is. And this is the anterior wall, the tensor tympani muscle. Yes, this is the Eustachian tube, and here is behind the opening to the mastoid antrum. Again, the same picture. Yes, the promontory here. Yes, round window here. Yes, oval window closed by the footplate of the stapes. Yes, the facial nerve. Yes. Again, the same. Can you imagine this? Yes, this is the medial wall here. Medial wall. This protrusion is the promontory. The posterior, the oval window, which is closed by the footplate of the stapes, and the transverse part of the facial nerve. Can you imagine this? This is transverse section. This is the external auditory canal. Yes. The drum, the middle ear cavity, anterior wall, posterior wall. Do you remember? Posterior wall is descending the vertical part of the facial nerve, and there is opening from the middle ear to the mastoid ear cells, the mastoid antrum. It's called aditus. And what is this? This is the medial wall of the middle ear, the oval window, which separates the middle ear from the inner ear, and this is the cochlea. It is called the basal turn of the cochlea, which has slight protrusion within the middle ear. It's called the promontory. And that's all for today. Thank you.